Welcome back to Healthy Living for Life. We're continuing our discussion with Dr. Melton and Tammy Jones from Melton Dental. So, Dr. Melton, before our break, we were talking about bone loss. And I know there is something called periodontal disease.
Yes.
Could you talk to our viewers about this?
Yeah, a common name that people hear is gum disease. And while gum disease is a part of periodontal disease, it's a disease of any of the tissues that surround and support the teeth. A lot of people have a misconception that cavities or root canals or these sorts of things are the most common cause of tooth loss, but it's actually periodontal disease destroying the bone that supports the teeth, and then the teeth are subsequently lost.
Can you talk to our viewers about what smoking and chewing tobacco can do to maybe exacerbate?
Yeah, absolutely. Any use of tobacco decreases the blood flow to the tissues in the mouth, so any insult or injury is going to be that much worse. So either chewing or smoking, they both exacerbate the disease and increase your chance of tooth loss.
And so one of the things that we think about is that gum disease and maybe other things that it might cause. So are there long-term consequences of gum disease?
Yeah, once again, gum disease is a common name, and periodontal disease is the more formal name. And ultimately, it's tooth loss, the loss of the dentition. But also there are other medical conditions that if you don't treat the periodontal disease, it really increases your chance of cardiovascular disease, stroke, and other serious medical conditions.
Wow. So when we were talking about smoking and chewing, we all know that those cause cancer, and as everyone knows, I think, dentists and hygienists can be some of the first to maybe detect this. So Tammy, can you talk about that and what you might look for in someone who smokes or chews tobacco?
Oh, you bet. Whenever you're seeing someone in the chair, you're in their personal space. A lot of times skin cancers are detected in the dental chair. If you're looking in someone's mouth, when you go through hygiene school and dental school, you're trained to look for, there's a wide variation of what is normal. Okay, we're all individuals. But certain spots, like when someone chewing tobacco, there's always the tissue inside the lip always gets a strange corrugated appearance. That's one of the first signs that happens. The gums recede. If you have particular speckled areas in the mouth or on the tongue, you're trained to look for that. And it also raises your inflammation level. And Dr. Melton was talking about the periodontal disease having a link to heart disease. When you lose that bone, if you think of your bone as like a zipper, really, really strong, and when you have an infection anywhere in your body, this is another infection. It is a disease. It isn't curable, it's just stabilizable. Okay? If you catch it in time and you treat it and you're seen on a regular basis and you lower your inflammation, which is your level of bacteria in your mouth that comes from your personal habits and your oral hygiene, you can kind of arrest it. Okay? If you have this bone connection, and we all have it, when the infection comes through, it kind of melts the zipper. This is a very simplified version, I'm sure. So here you have totally healthy bone, and then periodontal disease moves in, and say you don't treat it, or you have a lot of the habits that make it worse. Over time, it melts that bone connection. And along with the bone connection, there's a big periodontal ligament. It's the soft tissue connection. Like any infection anywhere in your body, it destroys tissue. So when you no longer have the foundation that your teeth sit in, they fall out, they get loose.
Ah, great segue into my next question. That was a great example. Dentures. So now my teeth have fallen out because of poor hygiene. Do people have dentures these days?
Oh, yeah, yes, they do. Depending on the situation, the patients that have severe rampant periodontal disease and there's just no other surgical option, then removal of the teeth and placement of dentures, being full or partial plates, are needed to improve their health. There are advances in them, though, especially for the lower teeth, placing implants and having implant-supported dentures to make them much more manageable and a nice option moving forward.
So for those of our viewers who might have dentures, are there tips that you can talk about that help them keep those dentures clean?
Yeah, I'll have to say I'm going to give kind of a personal recommendation. I know a lot of patients that have had dentures for years and years. They used to tell patients to take the plates out at night and soak them overnight, but we really recommend just finding a 15 to 20 minute period during the day to get them out, clean them, disinfect them, get them back in. The reason we don't recommend taking them out at night anymore is that actually can obstruct the airway and cause sleep apnea and other problems. So a 15-20 minute period during the day, get them out, disinfect them, and then back in the mouth.
Wow, so it's kind of a complex thing to think about when you're thinking about dentures. But in the few seconds we have left, getting in to see your dentist, how often? Minimally twice a year, right?
Yes.
And then what other one tip would you give our viewers for healthy gums and teeth?
Probably the single greatest, as far as improving overall health as well as oral health, minimizing liquid sugars, pops, coffee with sugar, and really kind of the trick there would be not so much how much you have, but how frequently. If you have you're sipping on your coffee with sugar all morning, that can be very damaging to the teeth in a very short period of time.
Great, thank you. Stay tuned to learn even more about how dental health can be an indicator to greater health issues occurring elsewhere in our bodies.